Hello viewers, welcome to another episode of Healthy India. We've discussed cancer several times in this program, different types of cancer, and those are all available on the Sunset TV YouTube channel. Today we'll be focusing on something very specific, that is cancer of the ovary. The woman's reproductive organs are placed like a triangle in the lower part of the abdomen, lower part of what we commonly call the stomach, the lower part. And it's like a triangle with the uterus in the center and two walnut-sized organs on the sides and little higher, which are called ovaries. So it's a uterus and ovaries which are connected by a fallopian tube. These ovaries play a very important role in a woman's life. Firstly, they are responsible for secreting female hormones like estrogen, progesterone and others, which actually control reproduction in a woman. And interestingly, they are also the organs where the eggs are actually formed. The eggs that allow a woman to conceive. So the ovaries are a very important part of a woman's reproductive system. But sometimes these ovaries can get diseased and they can even get tumors or cancer. So let's talk today about cancer of the ovaries with two of our experts who are in the studio with me. I have Dr. Sumit Goyal, who is the Associate Director of Medical Oncology at the Rajiv Gandhi Cancer Institute in the capital, in New Delhi. And I have Dr. Kanika Batra, who is a consultant in Gynaecologic Oncology at the Max Saket Hospital. So we have different streams. We have a surgeon and we have a medical oncologist, and we'll discuss with them aspects of cancer of the ovary. So, Dr. Batra, can I ask you, when we talk of tumors of the ovary, what are we really talking? Is it just one type of tumor, or how do you classify cancers or tumors of the ovary rather?
Right. So not all ovarian tumors are cancers. They could either be benign or malignant, and we have an intermediate entity also, which are called borderline ovarian cancers. So benign tumors are not cancerous and malignant tumors are cancerous. And the in-between entity, which is, as the name suggests, it is borderline. It has the potential to metastasize. It can go to the other areas of the abdomen, but it still doesn't behave like a malignant tumor. It's not invasive. That's the basic difference. And we have further classifications in the benign and malignant according to whatever histologies are there.
Tell me about the classification of malignant tumors, since that's the focus today.
Right. So the malignant subtypes can be serous subtype, which is the most common. 50 to 60% of ovarian tumors are serous in histology. It's basically a histopathological classification that we have. Or it could be clear cell, or it could be endometrioid, or it could be mucinous, which constitute to about 5 to 8% each. But 60% of them are serous.
And it makes a difference to the outcome, what type of ovarian cancer it is. Your treatment plans and your outcomes may differ based on the type of cancer?
Absolutely. So according to the histopathology, treatment mostly remains the same, in terms of surgery and chemotherapy. But in terms of the prognosis, I think it's very essential to understand what is the subtyping.
Right. So, we know that ovaries can get cancers. They are not among the commonest cancers. That also we know. We've discussed breast cancer here and oral cancers, which we know are very common. But they're also a great masquerader. We also know that, the problem with ovarian cancers is that they mimic other things. They don't come out with very clear symptoms, but we'll come to that. But who are the people who are more likely to get into this? Who should be more alert about screening or testing for ovarian cancer?
As you rightly said, sir, it is a silent killer because it takes time. By the time we come to know, it is already spread to a certain extent. So who are the people who are more likely to get it? So as such, if we look at it, there is not a well-defined entity, but there are people who are more likely to get it, like people who have never had children, then people who have had history of endometriosis, then people who have had history of cancer in themselves, like cancer of, if someone has breast cancer in the past, or
So the
uterine
patient herself has
Yeah,
had breast cancer.
Then they are more likely to, there's a possibility they may get second cancer in the form of ovarian cancer. Then there is a family history. Then there is increases someone in the family, the first degree relatives, they have suffered from ovarian cancer or breast cancer. Then there is an increased tendency. Then people with endometriosis, there is an association with clear cell carcinoma of the ovary. Then as we know, then there is certain families like the Jewish ancestry and certain families in India, I am not sure. And the commonest thing is like the people, it is the cancer is the disease of aging. As we grow old, we are more likely to get it.
So age, of course, makes a difference. And do metabolic factors make a difference, like obesity and others? Dr. Batra, do they make a difference?
So obesity is known to be associated with ovarian cancer, although it doesn't cause the sinister subtypes like the serous one. But obesity is known to cause known to have an association with it. And also, given the fact that if somebody is obese and has ovarian cancer, their overall prognosis is bad.
And the
with
treatment
respect
becomes
to,
harder also
it
sometimes,
becomes more difficult.
Okay. So, but there's also a role, Dr. Batra, in this of genes. And Dr. Sumit also mentioned that, when you have a history of cancer at some other place, especially breast, so obviously there is something going on there in our genes which can make us more prone, which can make women more prone to develop ovarian cancer. And I know that that's been the subject of great research in the recent years. Not much was known about it 2 decades ago, and gradually a lot of information has come in. So how would you place the role of genes in this?
So, talking about the hereditary cancers, specifically in the ovarian, we have the hereditary breast and ovarian cancer. So it is an entity, and BRCA genes 1 and 2, BRCA1 and 2 are the causative, mutations in these genes. They are known to be, transmitted from one generation to the other in an autosomal dominant form. So, in fact, now...
So, excuse me. So, when Dr. Batra is saying autosomal dominant, she means that we inherit our genes from our parents, right? Some can be somatic, that's later mutations, but we inherit genes from parents. And very often what happens is that you get only one gene, you inherit a gene from one parent, and that is dominant, that is called a dominant gene, and it produces its effects even though it's one. Sometimes what happens is that you need genes from both the parents to show an effect. That's how it happens. So in this case, BRCA1 and BRCA2,
even one is good enough.
Even one can be good enough.
It's a dominant gene.
So it's an autosomal dominant gene. Very important. Go ahead.
Yeah. So if somebody is known to have a BRCA mutation, then the risk of them developing ovarian cancer. So like let me just put it in a general population, the risk of ovarian cancer is to the tune of 1 to 3%. If somebody has BRCA1 mutation, their risk increases to up to 70%. The range is 30 to 70%. So if you have BRCA1 mutation, your risk of getting an ovarian cancer is to the tune of 30 to 70%. Whereas if you have BRCA2 gene mutation, then the risk is to the tune of 40%.
That's very high.
It's pretty high.
So that means these mutations really make one prone to develop these cancers. And which other cancers can be linked with this?
So BRCA, as Dr. Sumit pointed out, it's breast, if somebody has had a history of breast. So breast, ovarian cancers, they go hand in hand with these BRCA mutations, and otherwise pancreatic and in men prostate cancers are also known to have association with BRCA mutation. But primarily it is breast and ovary.
So what do these genetic effects do? I mean, does the tissue start proliferating undisturbed?
So what BRCA gene essentially is, it is a tumor suppressor gene.
Yes.
So tumor suppressor genes are known to keep, any kind of mutations that happen under check. So it's basically when your guard is off, the cells, they divide, which is what cancer is. and once they're off their guard, so there is no more the protective effect of the BRCA gene, the mutation is what causes those cells to divide in an uncontrolled way, which is what manifests as cancer.
So हमारे शरीर में ऐसे जीन्स होते हैं जो कैंसर को या सेल्स को बढ़ने से रोकते हैं, फैलने से रोकते हैं, और किसी में अगर उन जीन्स में म्यूटेशन हो, वो जीन डिफेक्टिव हो, समझ लीजिए कंट्रोल है किसी चीज़ के ऊपर और वो डिफेक्टिव हो गया, ढीला हो गया कंट्रोल, तो वो चीज़ एकदम फैल जाती है. तो ब्राका जीन 1 और 2 जैसे डॉक्टर बत्रा ने बताया, ये जीन्स अगर किसी में म्यूटेटेड हो, इसमें प्रॉब्लम हो, तो इसमें आपको काफ़ी हद तक रिस्क बहुत बढ़ जाता है. तो किसको टेस्ट कराना चाहिए इसका, क्यों टेस्ट कराएं? ऐसे अगर पता नहीं है डायग्नोसिस, सपोजिंग आई नो दैट दिस पेशेंट हैज गॉट ओवेरियन कैंसर, हु शुड टेस्ट?
So, in the general population, you mean?
Yes, general population.
So, we have, you
General
know,
population and in a patient.
in a patient,
Patient, of course, will come in
ovarian,
detail,
yeah,
yeah.
So, in a patient of ovarian cancer, now we do BRCA testing in all because
So good point,
Yeah.
done, because you need to know the other organs.
Yeah.
And in general population doesn't make any sense.
not in a general population unless and until you have a family picture, a tree that
Yes.
falls in the high risk, which
Yes.
your genetic counselor or your oncologist is going to decide for
Yes.
you. It is not to be done as a screening test in a general population.
Yeah, thank you for that very valuable, important information. And I go to Dr. Sumit Goyal now. And I think the most important part that people want to know, what are the symptoms? How does one suspect? How does a lady think that maybe I have something wrong with my ovaries, maybe I have a tumor, what should I do?
So it's a very important thing. The thing is to get suspicious about this thing, ki whether I have this thing in me, because the symptoms are so vague and they are so widespread. It is very difficult to pinpoint them to it is because of the ovarian cancer. As it is known as silent killer, it is because usually the initial symptoms are very vague and it can be easily missed, and it can be overlapping with the common ailments also. Like people usually start with having bloating sensation, feeling of early satiety, they feel full when they eat very less food, lethargy, vague dragging abdominal pain. Then gradually, or the patients are there who may develop suddenly there's a water in the tummy, or they get breathless, or they start noticing there are some lumps and etc. At that point of time, they start suspecting. Usually, initially, they are the vague symptoms.
किस एज में हमको ये अलर्ट रहना चाहिए, सस्पेक्ट करना चाहिए?
See, जैसे डॉक्टर कनिका ने शुरू में बताया, benign, malignant, then ovary has different components to it. So all ages, ovary can be a like site of cancer. Even in children, they can have germ cell tumors. Adolescents, they can have germ cell tumors. But as our age increases, like in the 30s, 40s, 50s, if we are having these vague symptoms which are persisting and are disturbing and causing changes in our daily life, like change in the bowel and bladder habit, we should be suspicious.
Very important points again, which tell us that ovarian cancer, because of the physical location of the ovary being deep in our abdomen, it may not manifest at all. So how does cancer manifest? Breast cancer manifests because you feel a lump in the breast, right? Some skin cancer manifests because you see it here. Now, ovary is situated deep in our abdomen, and it grows and grows and grows, and you realize it much later. So it is true that even now, most ovarian cancers are picked up late, unfortunately. And it was called a silent killer and all that. But as Dr. Goyal is saying now, and we'll discuss that after the break, with advances in treatment, outcomes for ovarian cancer have improved considerably. We'll take a short break and be back with you with more information about ovarian cancer.
देश के युवा हैं वो उस समय भी देखेंगे कि देश ने कैसे ये कमाल करके दिखाया है।
Welcome back after the break as we continue our discussion about ovarian cancer. So, Dr. Batra, how do we actually diagnose ovarian cancer? I mean, we've heard that it is difficult to pick it up on symptoms sometimes, but you suspect somebody went for a routine ultrasound and found something. Someone was losing weight and they found something. Someone, went for some other purpose for testing and they had a suspicion of ovarian cancer. So how does one actually confirm, how does one diagnose ovarian cancer?
Yeah. So given the symptoms the patient is going to come up with, their physician is going to do a basic examination. And beyond examination, we have the role of imaging, which is almost like a part of examination now. Most of the patients, they come with at least an ultrasound report where we would find ovarian masses or some deposits or some fluid. These kind of vague things are going to be reported. Then one moves on to, getting investigations in a very detailed way. So CT scan or MRI is essentially done depending upon, whether sometimes if it presents with fulminant deposits on ultrasound itself, then one would want to go in for a CT scan. Or if we are doubtful whether the mass that is there in the ovary, whether it is benign or malignant, then MRI is a better option. So there is no blanket rule as to whether to get a CT or an MRI, but it's customized according to what situation we are seeing. Then imaging of the rest of the body sometimes is needed if we are suspecting some metastasis to be there, for which we either get a CT of the chest or sometimes a PET CT. Then we also have a role of tumor markers. So tumor markers are essentially, metabolic proteins that are secreted, which help us A, diagnose in a way, and B, to follow up. So CA125 is another routine marker used for the surveillance of ovarian cancer, which is typically raised in an ovarian cancer. And then we have other tumor markers also available, CA19.9 and CEA, depending upon what is the histology or, the type of tumor that is there. Specifically, we can get them done. So essentially, this compromises of how we are going to work up an ovarian cancer patient with imaging and tumor markers.
So tell me more about tumor markers, because they are in use all around us. So you are talking of tumor markers in someone where you strongly suspect or whom you are following up with treatment. But they're also done very commonly as a routine these days. A lot of, our patients come and say, I want screening for cancer, I want tumor markers. And regardless of what we tell them, they will still go and get it done. So where should tumor markers be used? And we are talking of blood sample. Tumor markers, why? Because it's just a simple blood sample. It's a blood test. Labs are offer cheap rates and say, just get it done. And it's not going to hurt. It'll give you some idea. But sometimes, as I understand, they can be quite misleading. And, so what do you want to comment on that?
I think it's a big nuisance to get tumor markers in a general population. And to the extent that patients come with increased tumor markers, they are absolutely non-specific and, insensitive also to a large extent. So tumor markers are not to be done as a part of your general routine, health package that sort of comes.
Yes, they are being done. They are being done for that. And that's very misleading.
And it is very, very difficult for us to explain to the patient that you do not have anything, because they will not believe. If somebody has a raised CA125, in fact, this week only I have been, having such a situation, and that lady, she's been having a CA125 that is raised, gotten a CT also, gotten an MRI also, but still, she's not gotten any answer as to why CA125 is raised. And then, I cannot answer her. And then she's like, I want another investigation. I was like, there is no need. But she has again gone ahead and gotten a PET CT done now. So these are all futile investigations.
So are you also seeing this, and what is your opinion about that?
This is very true, sir. This is actually leads to more problems rather than giving us a solution or them, because we need to know and understand that these markers sometimes can even be raised in the benign conditions, like in non-cancerous conditions also these markers can be raised. They have a value if we have proven diagnosis. Ultimately, as ma'am rightly said, you rightly said, sir, it will lead to additional investigations, and in the end, we may not be able to find a particular answer to it, why it's raised. So it needs to be done carefully. It should not be a part of the general package.
So this is a very important message for everybody, and I keep writing about this. Unnecessary tests are actually a big problem these days, and one of them is definitely tumor markers, just being screened in general. Not a great idea. Ask your doctor what tests are required. Follow medical advice. Do only those tests that your doctor advises. Regardless of how inexpensive they may have become, don't ask for so many tests which are not needed, and you will often go off on a wild goose chase without any positive outcome, and then spend lots of money, time, energy in trying to sort out useless reports. I'll stay with you, and
Yes,
after we've diagnosed, okay, this lady has ovarian cancer. So the next step usually in cancer, and we've done
Yes,
3 or 4 programs before this on cancer, is staging of cancer. So you want to enlighten us about that?
sir. The staging in general means ki how far the cancer has spread. Basically, that is the staging. So why staging is important? It is important for a number of reasons. One, to know ki what we are going to plan for this patient. Like stage 1 roughly is the tumors, they are localized to the lower abdomen itself, to the pelvis. Stage 2, usually they have come to the abdomen, in the upper tummy. And 3, they have involved other organs of the abdomen. And 4, either they have gone beyond these abdominal cavity or has involved the liver. This is roughly the staging is. To do the staging, we need to do, as Dr. Kanika rightly said, we need to have CT scans, MRI scans, and sometimes we need to take out the water to prove that yes, it is because of the cancer. The patient might have fluid in the lungs or in the abdomen, so we need to tap it. So staging is basically to know how far the cancer has spread. So the treatment will change based on the stage, so stage is important to know. Like stage 1 patient, definitely we do not want to do FNAC or tissue diagnosis upfront. We just want to send them to the surgeon so they can take it out directly. And if it is advanced stage, maybe if the surgeons feel they won't be able to take it out completely, then we need to go for some form of other treatment, either chemotherapy, before going for surgery. So staging is important to know the planning of treatment, to know the prognosis and the outcomes. And in the academic purposes also, if we say stage 3, it will make everyone around the world will know what is stage 3. So uniformity of data is also important.
So staging in ovarian cancer is also very important, like in so many other cancers that we've discussed in the past. So, okay, once we've done the staging, what next? When I was young, when I was a student of medicine, ovarian cancer was like a pretty bad outcome disease. And just the diagnosis meant that, you probably lost the battle, but it's not true anymore. And I have many colleagues and friends and patients who've had this condition and done very well for many, many years. So there have been advances in treating ovarian cancer, like in most spheres of oncology. I'd like Dr. Batra to tell us a little bit about treatment advances for ovarian cancer.
So essentially, the treatment of ovarian cancer, it consists of surgery and chemotherapy both. So once you've been seen by an oncologist, a decision needs to be taken whether if it's an advanced stage. Sometimes we like to go in for neoadjuvant chemotherapy, that is chemotherapy first, followed by surgical assessment. Or sometimes if we feel that we can do a complete cytoreduction, we go ahead with surgery directly. So what is the most important paradigm change that has happened in ovarian cancer treatment is that we have gone from doing some sort of an incomplete resection, and we have data to support that, to doing complete cytoreduction. So ovarian cancer is a peritoneal surface malignancy. So the disease that starts from the ovary in most of the cases, about 70% of the cases are in stage 3 at the time of diagnosis. They've already spread out to the rest of the lining of the peritoneum, which is in the abdominal wall. So small deposits, they're there in most of the abdominal cavity. So taking out each and every single deposit that is there, visible with the naked eye, that is the most crucial aspect of an ovarian cancer surgery. and doing a complete cytoreduction, we call it, a score of CC0, where there is no visible residual disease left, is one of the most essential things in management of advanced ovarian cancer. And that is what has led to changes in the overall survival in ovarian cancer patients. And chemotherapy, we have had many advances in chemotherapy, which I think Dr. Sumit would like to describe.
Please.
So, as ma'am rightly said, if it is like advanced stages, we need to go with chemotherapy first or the targeted therapy first. The targeted therapies are the medicines which are added onto the chemotherapy backbone. Chemotherapy is basically the drugs which we use to kill the cancer cells. So, they are non-specific, they try to kill in a different way. So, like adding on of these drugs to the chemotherapy backbone, they have added more survival, more chances of responses, and more chances of prolonged and good quality of life. So we have anti-angiogenesis drugs, like BRCA was increasing the risk. So we have newer drugs which, because of the people who have these mutations, they are more susceptible, and those medicines can be used in such patients. These drugs are known as PARP inhibitors.
So there are advances there too. So you were saying something.
No, I was just talking about the PARP inhibitors. They have been like a phenomenal game changer in ovarian cancer management.
So there has been a big change in ovarian cancer treatment, as I was trying to point out, both in terms of the approach to surgery as well as in modern chemotherapeutic agents. So there is no need to get disheartened if someone is diagnosed. Good therapeutic modalities are available in dedicated hospitals and specialized hospitals which look after such patients. Last question to you, Dr. Sumit Goyal, because we're running out of time.
Yes, sir.
And the question is about prevention.
Yes, sir.
This is a public program.
Yes,
everyone wants to know, how can I prevent ovarian cancer?
So we also want, if there is, first of all, we need to know people with the patient, the people, not the patients. There is no one way of preventing it altogether. Unfortunately, there is no 100% way of reducing it. But we can have good healthy lifestyle, like reducing the alcohol consumption, maintaining good exercise schedule, and having less of fat in the body. Plus, to a certain extent, the pills, the OCPs, they give protection to a certain extent.
So birth control pills, they have some side effects, so they should only be taken under supervision. But use of birth control pills has been associated with a lower risk of ovarian cancer. That is important. And not having, that means estrogen exposure to some extent, I guess, because not having children is with a greater risk of ovarian cancer. Right.
So again, sir, the more important thing is if we know our family history, if there is an increased risk, so knowing the family history is also more important. If we know there is high predisposition, high risk, then the risk reducing surgeries can again be done to prevent the occurrence of the cancer.
Wonderful. I'd like to thank you both, and just to summarize for the viewers, आज हमने ओवरी के कैंसर के बारे में कुछ सीखा. ओवरी में कैंसर बहुत कॉमन कैंसर नहीं है, लेकिन एक छुपा हुआ कैंसर रहता है जो एकदम से मालूम नहीं पड़ता है, लेकिन आजकल उसकी अच्छी जांच और अच्छे इलाज के साथ लोगों के जीवन में बहुत अंतर आया है. इसलिए ओवेरियन कैंसर का डायग्नोसिस कोई इतना डेंजरस डायग्नोसिस नहीं है, और इसके लिए सतर्क रहें. जब आपको शक हो तो डॉक्टर से बात करें, अपने टेस्ट कराएं, सही ट्रीटमेंट लें, तो आप ठीक रह सकते हैं. थैंक यू वेरी मच.